Welcome to today's webinar. I'm Mark Greer with Acqueon. I'm the Product Marketing Director, and we're very pleased to have you join us today for this webinar dealing with the COVID-19 and how to have essential customer communications with your client base and suppliers. A little bit about Acqueon. We are a solution provider for conversational engagement software. We make it possible for people to communicate with their client base and whomever they need to communicate with via the preferred omni-channel of their choice. I want to take a few minutes to explain some of the things that we offer. Everything that we provide is proactive communications via the cloud, and we leverage machine learning and artificial intelligence to optimize the productivity of engaging customers. With regards to the panelists today, we have Nicholas Kauchkowski, who's the Chief Marketing Officer, and we have Frank Graham, who's the VP of Sales Engineering. And together with their experience, they have approximately 55 years of industry expertise regarding contact center and various other technologies involved with this sector. Housekeeping today, I just want to touch upon a few things. We really want to make this webinar extremely informational and useful to those that have joined us today. We understand your time is valuable, and we encourage everyone to ask questions. We really would like this entire webinar to be completely interactive from beginning to end. And you'll see the little panel to the right that you can pose your questions, and we'll ask them as a first come, first serve. And this webinar is being recorded, so once we finish today's webinar, within a matter of a couple hours, you will receive a copy of it. So with that said, let's turn it over to Nicholas Kauchkowski. Nicholas. Well, it appears we might be on mute a little bit.
Hey, thanks, Mark, and I really appreciate you attempting to pronounce my last name. There's a reason why I go by the nickname of NK3. It's so difficult to pronounce. But let's get going. And the first question for you, Frank, is we see contact centers across all industries, sectors. They're basically confronted with two things: spikes and surges and sustained volume increases. So what can they do now to face this situation?
Absolutely. I think there's obviously the circumstances we're in. The world is effectively turned upside down, and so as a result, as you mentioned, you have these incredible spikes in call volumes, and some of them are just that, spikes that can be dynamically handled, and others indicate sustained changes. As our economy has moved in a different way and people are operating in a different way and behaving in a different way. In some areas, call volumes have dropped off, but in many others, they've gone up incredibly and are at a sustained level. So yeah, I'm going to kind of separate those two, and let's start with the first, which is the spike in calls. So naturally, the idea is that you don't have enough resources at that point to handle that surge in volume. So the notion is that you will have resources later, or that you'll be able to segment those calls and call them back later, depending on priority. So the first thing we want to do is figure out how to call them back. And that's as simple as offering to a caller in queue an opportunity to leave their number and name behind, or prompted rather, say, may I call you back at this later time, when you have a prediction as to when you'll be available, or when you'll have resources available to call them back. And oftentimes, that's based on expected wait times and queue times. And all of us have experienced, whether it's calling airlines and so forth in recent times to reschedule or cancel trips and so forth, there were incredible wait times. And some just even dropped all calls together. So it's really important to offer this immediate callback to recognize the value of that client and offer these scheduled callbacks, and try to distinguish between critical calls that can be scheduled back at a later time and identify critical calls that need to be answered right away with the resources that you have.
So it looks so easy, and I've heard a lot of contact centers turning to callbacks to manage that influx. Mm-hmm. But it begs a bit the question, why callback is not widely adopted, widely spread? Any insights on the reason why?
Well, arguably one could suggest that it was, a big aspect was complacency. I mean, let's be honest here. This unusual circumstances that we're in right now have heightened to the nth degree the gaps in customer experience and user experience and helpful attributes of contact centers. And probably, and a good example to look at and kind of imagine, because you can see it both visually and you can imagine the situation on the phone as well. If you haven't actually called somebody like the Department of Motor Vehicles or Registry of Motor Vehicles, depending on which state you're in, people tend to create their own personalized callback plan. That is to say, if I go to the DMV to register my car and I see the line out the door, I go, I'll drive back and come back later. Same idea on the phone. When you pick up the phone and it says your expected hold time is 2 hours before you're able to talk to a Department of Motor Vehicle representative, most people will hang up and say, maybe I'll call it a different time or on a different day. And so in effect, you're creating your own personal callback. And it's hit or miss because you're not exactly studying their environment. Whereas if the Department of Motor Vehicles had gone through, the simple effort of saying, okay, let's offer this up. We can see our queue statistics and so forth, and proactively provide that scheduled callback opportunity, then you can see that that would be very helpful. So it's that complacency going, well, you're a captive audience for the Department of Motor Vehicles. The other aspects that have triggered, beyond complacency and captive audiences from the perspective of an enterprise or state agency has been that not all IVRs had ready-built callback functionality built in, or many enterprise clients thought it was overly complex to deploy. And so really, it's, I guess, a part of education here to let people know that it isn't really that complicated at all, that there are prepackaged, if you will, agnostic solutions that can work across a number of different vendors, IVRs or ACD platforms to provide that kind of scheduled callback in a relatively easy fashion.
So with the understanding that many contact centers, unfortunately, don't really have that capabilities, are looking to implement it, can you give us a sense of what does it take to implement? I think in the current situation, contact center operations are very sensitive to not rock the boat, minimize the changes, and proceed with baby steps. So can you give us a sense of the complexity of deploying, what it takes to deploy, and maybe some words of advice from your experience?
Sure. Fundamentally, it depends on how integrated you want the callback solution to be built into your existing environment. So there will be touch points. If you are, at a minimum, you have to touch that initial menuing system or IVR system up front to let people know that there is an option to be called back if you want to do it in that real-time dynamic fashion. So the key point is that you want to take advantage of these prepackaged solutions that I was mentioning earlier, where you have IVR scripts or pre-built IVR logic and so forth, whether it's the actual script itself or pre-recorded WAV files and so forth that you can put into place right away, or you can take advantage of cloud solutions. So, apart from your existing premise solution, be able to offer up just in the menu that, call this number. That's the most simple to implement, where you don't even have to touch in a deep fashion, if you will, the underlying IVR logic of your platform. So there's a myriad ways of bringing in cloud solutions that can work in parallel or complement what you have as well, versus or alternatively going all the way to making it fully part of your existing solution and touching the IVR scripts and existing capabilities that you have on premise.
So important, but there's so much you can do with callbacks. So what are the other options that contact centers and customer service operations have to deal with the volumes of calls that they have today?
Right. So this is starting to get to address the longer term or even medium term impacts of COVID-19, pandemic that's affected all of us. So at this point, you need to start thinking about, okay, given the fact that I've got heightened, sustained call volumes and the likelihood of being able to hire in a very short period of time a significant number of agents, onboard them, get them trained and so forth, to provide those kinds of resources are going to be limiting, at best. You've got to identify these resources and fold them into your infrastructure remotely. So that is likely to take a bit of time. So in the medium term, if you will, you can start looking at aspects of either self-service or proactive outreach to try to stem the tide of that additional, call volume flow that's coming in. A couple examples might be, switching to other channels because your precious voice resources, your precious agents, ideally are working in a triage fashion, handling critical calls. So for the non-critical calls, can I send them emails? Can I send them SMSs in a proactive fashion as part of a large overall campaign? A beautiful example I saw the other day was an actual automobile insurance company saying that for the next 2 months, and this was sent out in two ways, email and SMS, they're offering a premium discount, I think on the order of 20% for the next 2 months. Think of that message. One, it makes you realize that, okay, they care about you. It builds loyalty because they're acknowledging you should be sheltering in place so you're not driving. We as an auto insurance company, our risk has gone down. So therefore, they could have pocketed it, but cleverly they're saying, let's use this and reinforce the message that we're all in it together, reduce the rates, and it encourages the right behavior because they're applying that universally to all members. And so those people that are driving who probably shouldn't, is this truly a necessary drive, start to say, well, I'm getting credit for not driving. Should I do the right thing? And so it builds that community good and so forth. And most importantly, it stops incoming calls from potentially people saying, well, wait a minute, I'm not driving my car. Let me call in and start to add to the call volume. But no, with this proactive messages, you've stopped that and built loyalty at the same time and encourage revenue. Because what if that inbound call was, I may as well cancel my car insurance because I'm not driving for the next 6 months. So very clever ways of acknowledging sustained incoming volume potentially and reducing that. And by proactively reaching out with those kinds of messages, whether email, SMS, or even voice drops, leave a message on an answering machine driven by a pre-recorded message that you put on an IVR port to play back. So all these are clever ways of reducing systematically and continuously these types of potential inbound calls. So there's a lot of clever ways to do it, and really it's not the technology that's holding back. It's the thinking of the use cases and thinking about your own business and how to help out your customers, patients, and so forth in this time of need.
Thanks. So one thing I'd like to do is to dig a little more into automation and self-service, but we already covered a lot of topics, and I'd like to pause a moment to go over what we've discussed. What I personally found pretty intriguing, it's completely counterintuitive when you're overwhelmed with inbound calls that you want to do some outbound activities because you mechanically think, okay, I'm going to add some load to my people. And actually, many of the examples you gave basically are built on outbound as a way to reduce inbound. So, but the key topics that we've discussed so far to handle the surges and the increase in traffic volume is to provide an immediate callback of critical calls, because of course you want to make sure that they're treated as soon as available. And for the less critical calls, you schedule callback and you gain capacity, you can organize yourself. We've started to touch this notion that with notification, you can preempt calls. And ultimately, you can help reduce the volume of calls and drive what we call call avoidance. And we are starting to discuss the automation and self-service. So that's an area that I want to dig in before the pandemic kind of happened, most companies were engaged on the path of automation. It was top of the list. And for the past year or two, we've seen pretty big investments. So the question is, how are they able, how are contact center and enterprises able to leverage the investment they made in building automation capabilities platform, and what are the low-hanging fruit, how they can maximize what they have to help cope with all this influx of calls and maximize the efficiency of the teams they have.
No, good question there, Nicholas. So the notion that turning the inbound to an outbound situation on its head, if you will, suggests is so paramount today, given the fact that we clearly don't have enough inbound resources to address the spike volume. But if you had 1,000 agents and you have 1,000 customers simultaneously talking to them, but now you're getting 4,000 or 5,000 behind them wanting to talk to those same agents, there's no human possible way of being able to do that. So there has to be a rethinking of how you're going to address that deluge of 5,000 calls. And that's the notion that we're talking about right here is not all of them are critical. So for those non-critical ones, how can we get them out of that inbound queue and proactively reaching out to them with, we talked about a simple use case or a clever use case, I would say, from the automobile insurance company. There's a kind of a universal generic use case that's always available, and that's appointment setting. That's a very common event, regardless of the public sector, private sector. There's a notion of needing to interact with the company, whether remotely or if truly necessary in person, but ideally remotely. Those types of appointments can be set up, and that kind of an appointment interaction oftentimes has simple, basic pieces that you can pursue. So I would definitely recommend appointment setting as a starting point.
So it's very interesting you say that, and I'd like to better understand why you suggest to start with appointments.
Because fundamentally, all you really need to do is verify or capture the number if you don't already have it within your system as the person called in. Verify or confirm the person that wants to be called back. They can record their name, or they can confirm a text-to-speech playback. And then finally, the date and time of that appointment, or a time if it's later in the day itself. And so those simple, pieces of information, the callback mechanism or the reach out mechanism, if it's, confirm an email address or confirm a phone number for either a callback or an SMS. And then, as I said, the date and time. And you can add layers to that later, depending on the context of the appointment. If it's a healthcare situation, is there a particular specialist that you want to talk to, and so forth. If it's a different retail or other type of environment, then it's a different type of appointment context. But fundamentally, before you get to those extra layers of additional context, the fundamental pieces of just capturing name, number, and date, time is pretty straightforward. And you can do it in a number of different channels. So as an example, you can start off in the IVR, say, well, unfortunately, the expected wait time is in excess of 2 hours right now. Can we contact you at a later time? And at that point, you either offer up a voice callback or an SMS, depending on the preference of the individual. And this is where you can start to make use of the value of access to different channels and mediums. For example, if you say, hey, I want to talk to, or I want to schedule something, or schedule an appointment, you can send back the confirmation in SMS. And you start talking about SMS, clearly you can do it with a system-driven, where you've thought through the interaction and each potential outcome at a different juncture in that SMS interaction. Or you can now put to bear bots that are readily available. And these bots are very, very capable to help through that interaction without necessarily involving an agent. But through all this, you always offer the ability to escalate to an agent, because that encourages opt-in. I have a lifeline. I know I can reach out to someone, but since I know that, let me see if I can get further along here, because I'm motivated. I don't really want to wait 2 hours, so what can I do to do this transaction now? and acknowledge that it's not necessarily time critical. So I will schedule a callback. So it's very common across all different industries. So I think, as I mentioned earlier, appointments are the way to go, and relatively easy to implement.
Got it. So what else? What are other simple use case of automation that are relatively easy to implement now are you seeing?
Yeah, all kinds. I mean, the classic, I think some people will maybe go kind of binary and say either I have to fully self-service and automate a call or I have to put a live agent. But there's huge value in partially capturing information as well. So if there's an opportunity to capture information, if nothing else, to help with the eventual, in these days, classically you'd say segmenting the population into different valued customers or prioritized customers. These days we're using more the word triage to say which patient is in a more critical state, and therefore I want to make sure I call that individual as soon as possible versus someone else that is looking for information or looking for, let's say, test sites and so forth. Then clearly that potentially is a lower priority if there's no inherent illness at that point. It's more informational gathering and so forth. So follow-up activities, pickups now, very common where we're trying to minimize our interactions and maintain social distancing when shopping for food and things like that. So can we do curbside pickup? Do I want to really get in a big parking lot and get lined up and all that? Or can I schedule pickup times and drop-off times if you're doing donations and so forth during this critical time? You go to your local food bank and drop off food that to help out others that aren't as fortunate. So all these types of activities can be done through these kinds of appointment scheduling activities as well.
Yeah, it makes sense. So I want to park for now because it's a very interesting topic. All these new ways to do business, to conduct things that have been created or stimulated by the situation. It's when you think about back to the topic of automation, you spoke a lot about what can be done with two-way SMS and the options to get to the next level with bots. What other technologies should you consider using or can you leverage to automate things? Yep.
That's the beauty of today's technologies. They're an incredible source. So, earlier I mentioned that the automobile insurance company, and quite honestly, I don't know if it was someone who just came up with that clever idea to reinforce social distancing, not drive and so forth, and offer up the premium reduction, or was that potentially the result of analyzing call flows and call volumes? And when I mean by analysis, I mean the capability today with natural language understanding, natural language parsing, can systematically go through all your calls in practically real time and find out what are the intents of the calls. And perhaps maybe another way to think of that auto insurance example was someone identified, there's an increase or a spike in automobile insurance cancellations. Why is that? Oh, clearly people are realizing they're not driving, so let me cancel my insurance for the next 6 months and so forth. And so that could have been the source of, or the inspiration, if you will, to say, let's proactively reach out with this message. So between human thought, human ingenuity, creating great ideas, great use cases to pursue proactively, or using these new powerful tools that are available to us that can parse through all your call volumes in a given day, no longer just sampling and being at the mercy of a low sample rate, but systematically go through all your calls. What's top of mind for your patients or your customers or your members? Clearly, nowadays with the the Coronavirus Aid, Relief and Economic Security Act, CARES, that's injecting a huge amount of money, or should be injecting a huge amount of money into the economy shortly. And that is no doubt going to generate all kinds of inquiries for recipients, for distribution avenues. How do the banks handle it? They have a lot of questions on their head that they no doubt are going to be asking the Treasury. There'll be individuals that are, so there's all kinds of dynamic things that are happening that require, I would argue that would hugely benefit, if not require, these natural language understanding and parsing tools to be able to identify what are those specific inquiries if you don't have, a ready thought as to what they may actually be. So definitely took advantage of speech analytics in your ability to assess what to pursue.
Yeah, I heard it a lot, in particular for public services, where the question is, why cannot you update the web or change your IVR? And it's hard because you need to first understand the type of new questions that people have and how they ask the question. And sometimes it's so hard when you're on the other end of the line to anticipate how people are going to ask certain questions. So one thing which is interesting is a lot of this involves voice calls.
Right.
And we were on the trajectory from an industry standpoint with much more usage of digital channels. And there's also ways from an efficiency standpoint to leverage digital to be a little more effective. So what are you seeing in terms of, is it possible to shift to digital? Why are people not using more digital? Can you talk about a little bit about those two big modalities?
Yep. No, absolutely. I mean, I'm obviously more of a verbal person and so forth. I prefer talking to people over the phone and face-to-face. Clearly, there are other individuals that have different personal preferences that prefer, let's say, SMS or other communication means as well. And then, arguably, I'll be the first to acknowledge that certain information can be conveyed better in a different format. So trying to describe a graph or a table over the phone is going to take a long time, and you're relying a lot on trying to communicate an image or a picture in your head to another person. Whereas other items that you say, well, that would be so much more easily communicated verbally than trying to draw a picture of that particular word that you're trying to just say easily. So it depends on the context. It drives media usage and so forth. Clearly, at this time, at least it's my opinion that in times of urgency and so forth, we evolved with the ability to speak and so forth. So that tends to be, I think, for many people, the default. Oh, I got to call in and talk to someone live right away because this is urgent, and as you should if it's of a critical nature. But if it's of a more routine nature and so forth, then if you educate people or offer opportunities to receive the information in a different fashion, you can shift that behavior to paths that aren't or communication paths that aren't as demanding on the few voice agent resources that you have. A perfect example would be offering SMS from the IVR. I was starting to go down that path a little bit earlier when we were talking about appointment setting and so forth. So imagine that, this is you've never been to this food bank and you want to donate food. Well, I've never been there, so I need directions. And classic is, okay, where do I go? Well, I go down the highway, then you take exit 3, and then you drive here, and I'm verbally someone is communicating that, and I'm writing it down on a piece of paper and so forth to get directions. Well, of course, in this day and age, you set the appointment, and you can do it with an agent or ideally through SMS, and then the SMS interaction will say, or the IVR voice agent list interaction could say, would you like me to SMS the directions, the street address? And you see that on your mobile phone, and now you take advantage of your mobile phone. Typically has a mobile map application that will give you the directions right away, again verbally, as you're driving there to drop off the donation. So there's, you avoid the whole piece of paper, writing down notes, make a left at the light, and da-da-da-da. Now you actually have a street address. And that just really, I think, in my mind, conveys the value of technology today and how it's embedded in our lives, and that the choice use of the technology along the path achieves a much more efficient route. And in that particular example, I started out in an IVR agent list interaction where an SMS offered, or rather the IVR application offered up the ability to set the appointment, either in the IVR app or switch to SMS to set the appointment. And then the directions clearly were far better delivered from the SMS perspective than to try to provide a pre-recorded address, 123 Main Street. You'd have to scribble that down. So clever way of moving from one medium to the next, depending on the information that you want to convey.
Yeah. So you shared a lot of insights, and that's one of the reasons we wanted you on this program is you meet with so many customers. I think it's time to take stakes on what we shared. So obviously keeping the IVR and the web current, acknowledging that it's not that easy. focus on simple processes to make the most of automation. And you gave the example of appointment that look in so high demand. That's an easy, low-hanging fruit to start with. And very intriguing is this notion of starting with two-way SMS, pretty quick, that can be further refined with bots and extra capabilities that provide both a very easy access to a human, the ability to flip from voice to digital. Intriguing that I heard actually separately is the leveraging speech analytics to figure out what type of questions people are asking, and to use that to guide, to find new topics, new themes that can be automated or self-served, and eventually drive more proactively through proactive deflection, encourage consumers, the public, the communities to use digital channels. So a lot of levers. Let's move on to the third topic is what we've seen is with all the changes, there's actually new ways of doing things. And there's almost a new normal. When I see my wife doing, she's a teacher, doing video conferencing with kids, or one of my son doing some activities as a doctor over video conferencing, it feels that things are going to stay. Some new ways of doing things are going to last. Sorry, not stay, last longer. So, can you comment a little bit the new type of essential communication that needs to be considered, and maybe start with one that I've heard a lot about: disrupted supply chains.
Sure, absolutely. We talked about a number of, booking appointments. We talked about cares, distributing funds and so forth. And these things didn't exist, or the appointments did, but the care funds are brand new concepts that didn't exist before. And you would have figured toilet paper, the very example here, supply logistics. We hadn't really thought about it before. It's been there this whole time. I've attacked it more from the point of view of trying to help change and so forth, figure out how to better meter out customers arriving, and how to better communicate to those same customers when product would be available and so forth. But it's a very interesting case, and we were talking earlier about, is this a spike or sustained? And I've since learned that this is likely to be sustained, because the capacity of toilet paper on a shelf is very much finely tuned to give the appearance that there's always an infinite supply. But in reality, that toilet paper is arriving just in time each evening, pre-pandemic spike. Post that spike is going to take a long time to settle out. And the producers of toilet paper had actually had a lot of their consumption going to corporate entities, buildings and so forth. And their toilet paper capacity and size and shape is very different. So they're trying to shift that manufacturing. So you have all kinds of communication that needs to occur now, that all the manufacturers, distributors, and upstream through the logistics supply chain. So it's not just business to consumer, but business to business type of communication needs to occur now in a much more rapid fashion. Does this warehouse have it? No. Does this one have it? Stuff that you're completely unaware of as a retail consumer. And then on the flip side, that we're all very well familiar with, my wife has been on the phone calling all the various pharmacies and supermarkets, literally asking, when are you getting your next shipment of toilet paper and so forth. So there's a demand side need there, and now there's an opportunity for, as I said, all these various retailers to reach out to the consumers and let them know and try to meter out that demand. So yeah, there's quite an interesting impact to supply side logistics, both upstream business to business and downstream to business to consumer.
Okay, so it's funny, this topic issue, I should say, of toilet paper is here to stay as well for quite a while. But back to a topic, what can you do about it? How can you leverage managed communication to deal with those supply chain challenges?
Yep, no, absolutely. So the notion of launching, if you will, mini campaigns to inform both consumers of when product is going to be available on shelves and so forth, and even suggest times for them to come by to kind of spread out the demand so you don't create that false scarcity or the perception that there's a run on toilet paper, because the psychology of human consumers can take off very quickly that way. And likewise, many campaigns the other direction to up the business-to-business supply side to say, okay, sourcers of wood pulp and manufacturing, when are you able to shift to greater production of retail-oriented toilet paper versus commercial-oriented toilet paper and so forth, that, are hardly being used. Or maybe even clever ways of, setting up other campaigns to, and not just toilet paper. I mean, this is any logistics supply and revamping. Even think of coffee shops. They're no longer open, yet some are offering curbside service and so forth. So that's a different supply mechanism now in terms of making available coffee beans and grinders and making those repair parts show up if something breaks. And a shift of you no longer bring your own cup, we'll bring the cup to you. So that's a logistic demand. I need more paper cups because I don't want to touch a customer's cup of coffee or physical cup and so forth. So a lot of these aspects changed our behavior from before to now. And with these kind of educational / informational campaigns, you can start to address some of these supply chain issues, as I said, whether upstream or downstream to the retailer or to the consumer.
I understand that it's not just supply chain. One of the part of the new normal is how you can best manage critical resources. So one obvious example in the field of healthcare is emergency room or doctors. Those are critical resources that are due to the situation in high demand. So what are people doing and how are they building communication around that?
Yeah, exactly that. Building these appointment systems to make the most effective use of the doctor's time, because the last thing you want is a missed appointment, because then that very valuable resource was idle there at a time where clearly there was a whole slew of other potential patients behind that person that didn't show. So scheduling appointments for these very critical resources is all important. But it doesn't just have to be in a healthcare setting. We've talked about retail as well and touched a little bit on curbside pickup and so forth. So that notion of being able to, if you will, regulate the flow of consumers, whether the consumers are patients or actual consumers in a retail setting, of regulating that flow to make it easier on the retailer or provider to apply the appropriate resources for that particular transaction that's going to occur. And so that, diminishes congestion, less deliveries and supply chains to finally start slowly but surely catching up to the new steady state demand as a result of a fundamental change in how people are behaving out there in the economy and elsewhere in our lives.
So we're back a little bit on appointments. It looks super important.
Yep. Well, yeah, that's very true. I mean, appointments, fundamentally, we take a look at the hospital situation. Hospitals prior to this pandemic, let's face it, were staffed just enough, and the business model was set up such that the idea was I need to maximize the revenue coming in for the given set of resources that I've put into my business plan for staffing a hospital. And so much of that was geared around not having appointments be canceled, making sure every slot is available so you can get maximum utility out of your doctor and so forth, and presumably from billing to the payer side and so forth. Now it's completely upside down. There is no shortage of actual medical need out there to be addressed by these doctors. So therefore, if there's any elective surgeries or if you will, non-critical demands on the doctors, you don't want those individuals showing up to the hospital for several reasons. One, they don't want to get infected by COVID. And additionally, you don't want to distract those critical medical resources from dealing with the pandemic. So in that case, you really need to start thinking about the process we used to call segmenting, but now triaging to say, okay, those 100 doctors I have in the hospital, they're going to address the 100 critical patients, but the other 4,000 or 5,000 patients, you've got to come up with ways of proactively reaching out to them, still convey the information that they're seeking. If they're looking for test results, they don't need a doctor to read the test results to them unless it's of a critical nature. If it's a routine, you're not infected or you have a mild reaction to it, you're in the 80% category, that doesn't necessarily have to be conveyed by that critical resource. So coming up with ways to process those particular demands or requests by triage, by segmentation, and by proactively reaching out with the information that they need or want before them trying to either book an appointment or come in and hitting the hospital contact center and flooding the lines when they could have been proactively reached out and, as I said, informed with the non-critical information that they want without, as I said, consuming a critical resource in the hospital itself. So, yeah, appointments and that type of triaging is still very, very important.
Yeah. So I remember that was a takeaway when we prepared this program is I need to think of appointment, not just, we play with digital calendars. It's really a process.
Sure.
And you mentioned that for doctors, the no-show and cancellation was before the crisis above 20%. So it's pretty staggering and there's such a waste. So in today's environment, you do want to make a better use of the time, and the same apply for retail and other type of applications. So what we spoke so far is supply chain requires tons of communication that can be managed like mini campaign. The appointment as a process is something that can be leveraged, should be leveraged to manage all critical resources. And it applies to healthcare, it applies to retail with pickups, delivery, the coordination of the last mile, where you provide an indication where to pick up things and you want to be able to talk to people. And again, we have this recurring theme that new ways of doing business should be promoted. You need to inform through some kind of campaign, notification, whatever you want to call it, in the form of an integrated experience where you can shift from, okay, I have this option, now I'm going to do it, and I can call at any time to ask questions. The final topic for our program today is dealing with the issue of remote and work from home. So I'm sure you're exposed to tons of projects where all contact center customer service organizations are shifting or still in the midst. So can you give us a little bit of a status where we are from and what you've seen in terms of shifting the agent and customer service representative from and the workplace to home?
Sure. Well, as you can well imagine, it was in everyone's interest from corporate entities to individuals to work from home and follow the guidance of shelter in place and social distancing and so forth. And by definition, classic contact centers had been concentration. It's a center. It's centralizing lots of individuals and supervisors and so forth to achieve certain efficiency gains by management by walking around and so forth. But that is not at all conducive behavior or good behavior during a pandemic. So getting everyone home is easier said than done, especially if it's a premise environment, trying to extend out just the basic voice connectivity to each individual home. And clearly with voice via IP and so forth, a lot of that is assisted, but there were still plenty of issues with regard to extending out quality voice to individual agents' homes, connecting them back to that centralized, automatic call distributor and other capabilities. The desktop applications themselves, extending out VPNs or other ways to securely extend out the application that the agent needs to use in order to affect the conversation or the inquiry that's being made by a customer, a member, or patient, and so forth. So there were a lot of those initial issues that had to be dealt with. And then the fact that the environment is no longer a classical, business office environment or contact center agent cubicle, but rather it's their home. So you have family life now and other intrusions. I think everyone, since we're all in the same boat together, are more forgiving, but it still has, there are still issues of, well, you've got to take care of the children. There will be noises in the background and so forth. And I think most people are understanding, but it's different behavior. And clearly supervisors have to say, oh, well, I can't grade, my agent on what would be considered traditional business behavior because now they're in a different circumstance and so forth. So everything from technology to organizational behavior changes had to occur in a very rapid state. I'll argue that many have done that, but maybe not at the full capacity quite yet that they enjoyed when they could centralize all their resources.
Yeah, I heard a big challenge is communication, coaching, how you can monitor, and there can be some security ramification. I've heard that the pandemic would be the nail in the coffin of on-premises system. Obviously, those that were already leveraging a cloud infrastructure were able to pivot to this new way of working. What do you see the impact of work from home to cloud adoption?
Yep. No, it's interesting. I mean, I think the floodgates, of course, if I could predict the future completely, in a different spot for sure. But if I had to prognosticate, I would say yes, absolutely. The floodgates are open on cloud solutions. I mean, those that were already on solutions, as you intimated earlier, they're just driving full bore and expanding capacity. Those that were in transition with a few proofs of concept are growing those tremendously. Those that were still premise-based have opened up pilots for small lines of business, groups of 10, 20, 30 agents and so forth to get moving down the path, because this was an eye-opener in terms of the ability to, yes, respond to a pandemic if you had, remote cloud resource access. So all the aspects of establishing and even hiring employees who had good connectivity in their home was contingent upon, having that connectivity to be able to be an employee or an agent. Those processes are coming into play for sure going forward. And as I said, those that were already going down that path, had that ability to readily switch or readily adapt or support this environment. But I guarantee you, based on not just a few anecdotes, but systematically, it's about every client I've talked to has been saying, is this available for the cloud? Will this support being able to work remotely from home and so forth? So absolutely, a huge surge in interest in the cloud. Yeah,
it's a bit difficult because right now there's also prudence with so many things going on, but it feels that as soon as things will stabilize, it will grow definitely. And it's also a way to deal with something that I see surfacing growingly is how you can expand the pool of resources. So leveraging employees. We have, by virtue of the outbound communication is a little more predictable. So it's an easy way to take out slivers of interactions to other workers, and outsourcers is also another way. Let's recap a little bit what we've discussed. So obviously the guidance, if I may use that term, because it's more commenting what people are doing, is building the infrastructure to support work from home and to go beyond the laptop and VPN to make sure that from the management of the changes, the coaching, monitoring, and of the agents, and eventually the scheduling as well to cope with difficult situation. Security issues, we touch a bit on it. It is an issue that people will have to solidify. Accelerating the transition to the cloud as quickly and efficiently as possible with all what we said. And there are options to expand the pool of agents, in particular on the cloud infrastructure with VPOs. and by shifting communication activities that are more predictable to the outbound resource. So, Mark, I think with this we end the formal part of this program, and you might have a few questions from the audience that you want to ask Frank while we have him.
Yeah, I'd like to take this time right now to unmute, if I could. If there's questions you'd like to pose to Frank or to Nicholas, if you'd like to put it in the Q&A box. At this time, we'll pose the questions. So there's one on the QA box, and the question was about the follow-on on the discussion we had about call diversion using SMS and bots. Can you comment the top 2 to 3 cases or maybe industry examples to make things a little more specific? And Frank, you muted.
There we go. Okay, thank you. Appreciate that, Nicholas. Yeah, there's no shortage of bot orchestration, if you will, but again, because these bots can be imbued with natural language parsing of SMS text, and even the Lex bots on the voice side can be natural language understanding of voice itself. But in a simple SMS bot scenario, we're seeing again, back to the appointments. If you have a back-end system that knows the available slots that can be used to fill an appointment, then that's information available to the bot that's either scripted or you have the intent, right? You need to capture, as I mentioned earlier, telephone number, name, and daytime slot. So you interact back and forth by texting. You text out. Please let me know, what date and time would you like to book an appointment? And if the person only types in date, again, with the bot being able to parse through that text, we'll say, well, I only see a date there, but I don't see a time slot. And I know there's 5 slots available to me by checking the back-end system that made that available to the bot. So the bot then is clever enough to come back and say, well, I need 2 slots to be filled. I've got one intent slot. So let me ask for the time. And so that capability is built into many bots today, and it all depends on what transaction you want to achieve. So appointment is the most common one that I've seen where using bots, but there's also bots for, if you will, frequently asked questions. Type in, I'm waiting to talk to an agent. The IVR presents and says, would you like to interact with an SMS bot? Perhaps we can answer your question. And then you freeform type the question. The bot analyzes natural language processing, analyzes the intent, and says, these 3 or 4 FAQs are typically the ones that answer that kind of a question. You map the first one to it, and if they say, did that answer your question? No, you move to the next and so forth. And in that process, you're also creating a learning system as well, such that the next time you offer the second frequently asked question when someone types an SMS that mimics that first person. So it becomes a self-improving loop as well. And again, what you're really doing is orchestrating instead of the classic customer to agent. Now it's customer to an IVR voice resource or an SMS resource that happens to be driven by a bot as opposed to a human, but it's obviously far more efficient and far more scalable, especially in this day and age with peak volumes.
Thanks. Mark, any other questions we have?
Doesn't appear that we have any more questions.
On the top of the hour.
Yeah, we're coming up close to the top. It's pretty much time to wrap up the session. If you're interested to learn more about this subject and how you can do some of these things that Frank and Nicholas have covered, if you visit acqueon.com/COVID-19 / that will give you the information, a little bit more information. And of course, we'd like to thank our panelists, Nicholas and Frank, for their time. Today's recording has been recorded, and we'll be sending that out shortly within the next 12 hours. And if we could ask all those that are still with us, if you would mind completing a short survey, we'd really appreciate that. On behalf of Acqueon, we'd like to thank you for joining us today. And remember to stay safe and wear a mask. Thanks again for your joining us, and have a wonderful day.
Thank you. Stay safe. Take care.